I'm John Moore. I'm a gastroenterologist here at Fayetteville Diagnostic Clinic. I'm originally from Fort Smith, Arkansas. I went to college here at the University of Arkansas and studied chemical engineering. And then I did my medical school at UAMS in Little Rock, followed by an internal medicine residency there. And then finally, I did my gastroenterology fellowship in Buffalo, New York before coming back to Fayetteville to settle down. When discussing cancers, colon cancer is very common. It is the third most common diagnosed cancer in men and women, and unfortunately it's the number 2 cancer killer in men and women. In 2007, about 142,000 people were diagnosed with colon cancer, and about 52,000 people died from colon cancer. It has equal incidence in men and women, and there are some studies to suggest that it has a higher incidence in the African American population. The risk of colon cancer increases as we get older, and in fact you'll find that about greater than 90% of colon cancers are diagnosed in people older than the age of 50. There are several risk factors associated with colon cancer: a history of inflammatory bowel disease, a personal or family history of colon polyps or cancer. There are genetic colon cancer syndromes, a low-fiber, high-fat diet, obesity, tobacco abuse, and alcohol are all associated with colon cancer. In short, everyone should be screened for colon cancer. It's important to remember what a screening test is. A test or procedure to detect polyps or cancer in your colon when you are healthy and not having any problems is a screening procedure. If you're having blood in your stool, changing your bowel habits, or other problems, that would be a diagnostic procedure. So for purposes of colorectal cancer screening, everyone should begin, men and women, at the age of 50. The only caveat to that rule is that African Americans need to begin colorectal cancer screening at age 45 for men and women. They've been proven to have an increased incidence of colorectal cancer and polyps. Although we're getting better at screening everyone for colorectal cancer over the years, we're still not perfect. In fact, about 1/3 of patients over the age of 50 do not participate in colorectal cancer screening. And it's thought that about 60% of deaths from colon cancer could be prevented by getting the whole population screened. Colon cancer develops within colon polyps. The best way to describe what a colon polyp is it looks like a wart on someone's skin, but on the inside of the colon. That's the way they look. And what they are, they're just areas of the colon wall which exhibit exuberant growth. Studies have shown that colon cancers develop from within polyps, and it takes a variable period of time for a polyp to form and then a colon cancer to form within the polyp and start growing even more rapidly. Not every colon polyp turns into cancer. In fact, very few do. There are several types of colon polyps. There are hyperplastic colon polyps. These do not have malignant potential in over 99% of cases. Precancerous types of polyps are called adenomatous polyps. And these are the types of polyps that we need to remove to prevent colon cancer. There are several other less common types of colon polyps as well, which may be removed during your colonoscopy. Screening for colorectal cancer is broadly divided into 2 categories: cancer prevention tests and cancer detection tests. The preferred test for colorectal cancer prevention is the standard colonoscopy. The advantages to colonoscopy are that we're able to look at your entire colon for polyps. Also, if we see polyps, we remove them or eliminate them on the spot. It's also proven to be the most accurate test for detecting polyps and cancer, although it's not perfect. There are several disadvantages to colonoscopy, like any test. There is preparation required the day prior to the test. We'll talk more about that later. You have to have a chaperone to your colonoscopy because you'll be sedated for the test and you can't drive home. Colonoscopy is more expensive than some of the other screening tests for colon cancer. Also, there are potential complications to colonoscopy, including perforation of the colon, which is roughly 1 in 1,500. In summary, I recommend all patients who are able to undergo colonoscopy for their colorectal cancer screening. Flexible sigmoidoscopy is an alternative cancer prevention test. It involves using an endoscope similar to a colonoscope that only looks at the last half of the colon. The preparation for flexible sigmoidoscopy is easier. It generally involves enemas prior to the procedure, and it has been proven to be effective at reducing mortality from colorectal cancer. There are several disadvantages, though. Number one, patient tolerance is poorer with flexible sigmoidoscopy because the patients are not given sedation. Because they're not given sedation, they do not need a ride or chaperone to the test. Flexible sigmoidoscopy is a bit cheaper than colonoscopy. Another disadvantage is that if you find a precancerous polyp on a flexible sigmoidoscopy, it is recommended that patients undergo a full colonoscopy because you would then be at higher risk of having polyps at the beginning portion of the colon, which the flexible sigmoidoscopy does not reach to. Hemoccult stool cards are another common screening test for colorectal cancer. They involved testing the stool for traces of blood. And if these cards are positive, you will be referred for a colonoscopy. I recommend that these stool cards be done at home and performed on 3 spontaneously passed bowel movements. You also need to make sure that you stop aspirin and other NSAIDs prior to collecting the stool cards. Also, you need to avoid eating red, rare meat and certain cruciferous vegetables prior to the test. The Hemoccult stool card testing should be performed yearly, and if there's a positive test, you'll be referred for a colonoscopy. Fecal immunohistochemical testing is another screening test for colorectal cancer. This is also designed to detect blood in the stool. This is a newer test than Hemoccult stool cards, and it's a little bit easier to perform. Not as many bowel movements are required, and there are no medication or dietary restrictions to the test. It is more expensive to perform, which is a disadvantage. If you have a positive fecal immunohistochemical testing, then you will be referred for a colonoscopy. One of the newer tests to screen for colon cancer is fecal DNA testing. And what this test does is detect traces of advanced polyps or colon cancers in the stool. Advanced polyps and colon cancers tend to shed cells that have DNA in it, and that's what this test picks up. This test is more expensive to perform than either fecal immunohistochemical testing or the Hemoccult stool card. Also, this test does not detect all polyps and cancers. And I think that this may be a test for the future, but right now it is not quite ready for prime time, as the assays that are being utilized don't have all the possible combinations of DNA to look for. So I think this is a test for the future. Now we're going to talk about the procedure. Of course, I speak to many patients after they've been through this process, and the overwhelming majority tell me after this procedure is over with that the preparation and the procedure itself all went far better than they imagined. So my goal here is hopefully to get everyone screened for colon cancer. After you've met with our scheduler and picked out a date and time for your procedure, we will send you out very specific and detailed instructions about how to prepare for your colonoscopy, as well as a prescription for the colonoscopy prep. We're currently using 2 different types of prep for the procedure, Go Lightly and Suprep. And we've tried all the different preps, and we've settled on these 2 because they work the best, and they clean out the colon the best, and that's what's most important about this test. About 3 to 4 days prior to the procedure, our office staff will call you to confirm your appointment. We'll also discuss your insurance benefits and answer any questions that you might have. The day prior to the test, you're going to begin a clear liquid diet with no solid food. In the afternoon of your day before the procedure, you begin drinking your bowel prep. Some people have trouble tolerating that volume of liquid, And if you begin to have bloating or nausea or other issues, I just recommend that you slow down and let it process before you drink more. If you have any questions or concern, you can call one of the gastroenterologists, and we give you that information in the prep instructions. After midnight, you don't eat or drink anything. You'll be scheduled to arrive at the endoscopy center 30 minutes before your procedure. We'll get you checked in, we'll take a medical history, get your vital signs, and you'll get an IV started. We give Versed and fentanyl typically for these procedures. They're very powerful medicines, and you're very likely to not remember anything about the test and to wake up in the recovery room. The test takes about 30 minutes to perform, and you'll meet with your doctor after the test to discuss the results. The recovery period after the test takes about 30 minutes as well. So the overall time that you should be in the endoscopy center is about an hour and a half to 2 hours. If we take samples or remove polyps, you'll get a letter about the pathology results about a week or two later. You do not need a referral from your physician to schedule a screening colonoscopy. If you're having a specific problem with your colon, such as blood in your stool, a change in your bowel habits, or abdominal pain, that is a diagnostic colonoscopy, and you do need a referral from your physician for that. There's a couple of ways which you can schedule a screening colonoscopy with us. You can visit our website at www.northhillsendoscopy.com, and we have a link on there to request a screening colonoscopy. You can fill out some of your information, and we will call you back to schedule. The other way is by calling our endoscopy center directly and speaking with our scheduler, Christy, at 582-7289.